Peds Patrol here, and really tragic news in Edmonton where two teenagers this week were found guilty of very significant crime. Here's what you need to know. So, both teenagers are facing criminal charges. And why is this important to a pediatrician, you may ask? So, according to the Canadian justice system, if a child or teenager is convicted of first degree, they may be facing up to 10 years in prison and potentially up to 7 years if convicted for second degree. Worst case scenario, if they get tried as an adult, they may be facing up to life in prison. As you can imagine, this can affect a child and teenager's development and growth and understanding of the world, especially when they're not in school, working, developing healthy and successful relationships, or being a regular contributing member of society. I'll link some articles below, but there's been scientific data that looks at why teenagers are at risk of committing crime and entering the criminal justice system. There are significant health determinants such as poor neurodevelopmental skills or being neurodivergent, previous mental health, trauma, and experiences in maltreatment, all in any capacity, can contribute a child or teenager to be more inclined to commit crime. Not only that, but a predictor of adult criminality is based on adolescent criminality. So, by addressing mental health issues and other medical health issues in youth, we may be potentially helping a child or teenager reduce the risk of criminality once they become adults. Another Canadian study looked at mental health services needed by children and young adults between 12 and 24 before their incarceration and found that 65% of those individuals did seek mental health support. That's quite staggering. Some of the challenges that they found were barriers to seeking mental health support, increased dropout rates, or youth finding that the mental health supports were not working well enough for them. All in all, what this means is that as pediatricians and healthcare providers, we need to be strong advocates for mental health. Now, during the teenager years, there's a significant amount of hormone changes, behavioral changes, peer pressure, and not a lot of trust and rapport is being built with their healthcare providers. But I think as parents, as physicians, as healthcare providers, and those in the community, we have to work really hard to identify these issues and identify youth at risk. By creating programs that are geared towards teenagers that ensures sustainability, we can ensure long-term success and outcomes for these children.